Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting is being interpreted in American Sign Language by Kim Rich. Carlos Saracedo is interpreting this press conference in Spanish. His interpretation will be available on the county's website and YouTube page shortly after we conclude this press conference. Today, in response to dramatically increasing COVID-19 cases across the country, California Governor Gavin Newsom, Oregon Governor Kate Brown, and Washington Governor Jay Inslee issued a joint travel advisory urging visitors entering their states or returning home from travel outside these states to self-quarantine to slow the spread of the virus. The travel advisories urge against out-of-state travel and ask people to self-quarantine for 14 days after arriving from another state or county. The message is the same from San Diego to Seattle, across the entire west coast of the United States. Please don't travel right now. Governor Newsom announced that California just surpassed a sobering threshold, 1 million COVID-19 cases, with no signs of the virus slowing down. Governor Newsom reminded us that increased cases are adding pressure on our hospital systems and threatening the lives of seniors, essential workers, and vulnerable Californians. Travel increases the risk of spreading COVID-19, and we must all collectively increase our efforts at this time to keep the virus at bay and save lives. In addition to urging individuals arriving from other states or countries to self-quarantine for 14 days after arrival, the state's travel advisories recommend individuals limit their interactions to their immediate household. Oregon Governor Kate Brown said COVID-19 does not stop at state lines. As hospitals across the West are stretched to capacity, we must take steps to ensure travelers are not bringing this disease home with them. Washington State Governor Jay Inslee added, COVID-19 cases have doubled in Washington over the past 2 weeks. This puts the state of Washington in as dangerous a position today as they were in March. Limiting and reducing travel is one way to reduce the further spread of the disease. Here in Santa Barbara County, our case numbers are significantly better than both our neighboring counties at the present time. On Tuesday of this week, Ventura County and San Luis Obispo County received their first purple state report cards since they'd moved forward into the red tier. If their cases continue in the wrong direction, they will officially be in the purple tier next Tuesday. Around the state of California, 11 counties moved backward into more restrictive tiers. While our adjusted COVID-19 case rate of 4.3 was much lower than Ventura and San Luis Obispo County's 7.2 case rates, our own local cases are also increasing, especially in the past few days. Now is the time to increase our vigilance and diligence. The Santa Barbara County Public Health Department has continued to urge local residents to avoid gatherings of all kinds. Let's all redouble our efforts to slow the spread of the virus by paying careful attention to our public health officials' guidance. Please don't travel out of the area and avoid gathering with people outside your immediate household. As we move into the holiday season and are adjusting our holiday traditions to keep our friends and family safe, it's also important to find creative, safe ways to help support our local businesses. The upcoming holiday season could make or break many local businesses if we don't rally now to support them. To help in this effort, Women's Economic Ventures, WEAVE, is launching a virtual shop local market to safely bring shoppers to local small businesses this holiday season. The marketplace will feature more than 50 local women-owned and minority-owned small businesses who are part of the WEAVE community. The 26-day dynamic online shopping portal will be open online from November 17th to December 13th and can be accessed by visiting WEAVE's website at www.wevonline.org. WEAVE CEO Kathy Odell said small business owners in Santa Barbara and Ventura counties need our community's support this holiday season more than ever because fourth quarter sales may determine which of our favorite local shops will survive into the new year. Downtown Santa Barbara, the City of Santa Barbara, and other community partners are sponsoring the new Thursday night markets on the State Street Promenade. While physical distancing and wearing a mask, you can support local businesses and enjoy the creations of Santa Barbara's own arts community. Please help support our local businesses by doing your holiday shopping locally. National online retailers don't need our help over the holidays. Our local businesses do. Finally, I'd like to thank every veteran and their families for their service and sacrifice for our country. We owe a great debt of gratitude for their willingness to put themselves in harm's way to defend our freedoms. This year has been especially difficult for those on active duty service in our country because of the added complexities created by COVID-19. Many military personnel have had leaves postponed and canceled, and travel restrictions have limited opportunities for military personnel to visit loved ones. On behalf of the Santa Barbara County Board of Supervisors and every resident of our county, I want to say directly to every veteran who hears this message, thank you very much for your service and dedication to our country. I'd now like to introduce Dr. Joe Reynoso, the County Public Health Director.
Thank you, Supervisor Hart. Good afternoon. This past Tuesday at the Board of Supervisors meeting, we launched a new community dashboard. I invite you to visit publichealthsbc.org to explore the information regarding our county's tier status, get up-to-date information about cases, as well as view the historical trends. The dashboard also contains information on our hospital capacity, as well as links to COVID-19 status in the state, our country, and the world. Like most places, we are also seeing a significant upward trend in our cases. Our daily case rate is currently at 4.3% per 100,000. But earlier today, I was reviewing the cases by episode date for the next rating period, and I have to be honest, I was worried. I am worried. We're experiencing a steady increase in cases on a daily basis. Just this week, 11 countries, as Supervisor Hart mentioned, have moved back to a more restrictive tier, with no counties progressing forward with reopening. Our neighboring counties, Ventura and SLO, have been assigned their first week in the purple, the most restrictive tier. We may soon follow them back to the most restrictive tier unless we reverse this upward trend. Every person in this county must double down and must continue to wear your mask, maintain your distance, and stop gathering with people outside your household. As we have seen throughout the country, the state, and our own county, outbreaks can happen when there is a gathering, even as small as just a few people. Once again, I urge you to limit attending events. With sharp increase in cases statewide and countrywide, we need to rethink how we will celebrate the upcoming holidays. Thanksgiving is just around the corner and is typically a time when many families travel to celebrate together. This year will have to be different. The state of California has issued a travel advisory and guidance, which includes a recommendation that those traveling outside California practice self-quarantine upon their return. Travel and mixing households increase the chance of contracting and spreading the virus that causes COVID-19. The Santa Barbara County Public Health Department does not recommend travel during this pandemic. The current Santa Barbara County Health Officer Order does not allow private gatherings of any size. As you plan for your holiday, please take the following tips into consideration. Based upon your plans, evaluate your risk for contracting the virus. Consider a virtual holiday meal where you connect with loved ones by video chat. Honestly, assess any risks posed by various methods of travel, such as traveling on an airplane, train, or bus. Be open and transparent with family and friends about concerns, illnesses, and expectations. Please visit our website for tips on celebrating Thanksgiving in a safer manner. Thank you for doing your part to contain the spread of COVID-19 in our community.
Thank you, Dr. Donoso. Dr. Henning Ansorg, the county's public health officer, is also here with us today.
Thank you, Supervisor Hart. Good afternoon, everyone. We are seeing a significant surge in new COVID infection hospitalizations across the US and worldwide. In some areas, new COVID hospitalizations are starting to strain and even overwhelm the local health infrastructure. Several large cities, states, and many countries are implementing school and business closures to try and stem this new wave of infections. After thorough consideration and in light of this new wave of the pandemic, we decided to stay the course with our strict no-gathering mandate for Santa Barbara County until the end of the year. A significant number of counties in California had to revert to more restrictive tiers just this week. This has significant impact on school openings or closures and business operations in those areas. We want to avoid that to happen to Santa Barbara as well. Both of our neighboring counties, San Luis Obispo to the north and Ventura to the south, had new case rates consistent with the purple tier. We do know that private gatherings, small and large, are important drivers of new infections. We believe that keeping the restriction on gatherings has kept our new infection rates lower and is effectively slowing down the anticipated uptick in cases and hospitalizations. The year 2020 has been very challenging for all of us. Fortunately, however, I am pleased to report that the vaccine development is making significant progress. We are looking forward to the first vaccine doses arriving to the county possibly as soon as in late December or early January. Being able to offer the new coronavirus vaccines to everyone during spring and summer of 2021 will help turn the tide and change the trajectory of the pandemic profoundly. Until then, please keep yourself and others well by keeping a social distance, avoidance of gatherings, wash your hands frequently, and wear your mask. Thank you for your cooperation.
Thank you, Dr. Ansorg. We'll now go to questions from the room. Mr. Devine?
Dr. Ansorg, just kind of following up on that last statement with the vaccine possibly arriving in late December, early January. In that scenario, who would be the first people that would be able to be vaccinated?
That is currently being discussed at the state and county levels. Currently, most likely, healthcare providers that take care of very vulnerable populations in hospitals and settings, as well as first responders, and then next in line would be the elderly in facilities like nursing homes, because they have the highest mortality rates from the infections.
And how do you guys, if it were to happen in late December, which is very soon, would it be, where would it be administered possibly?
We are working on that. We're having at least 4 meetings per week just to get the logistics out, but it would be a very widespread effort between not just public health department, but we will include pharmacies. Hospitals will take their workload on to vaccinate their own employees. So it will be a very, very concerted effort with the whole healthcare infrastructure.
Thank you. And I guess another question for you is earlier you had talked about a few weeks ago about that nightmare scenario of Thanksgiving coming right when the cases start to rise again. In your opinion, how can we prevent a huge uptick in cases from people coming into Santa Barbara for Thanksgiving?
Yeah, that's a tough one because Thanksgiving is, such a beautiful holiday, and it is just traditionally always connected with significant travel of many people from various areas. And I just urge everybody to really rethink that. And basically, we advise not to travel. It is just not safe.
And then another question for Dr. Do Reynoso. You were talking about how you're a little worried, to be honest, with the significant upward trend in daily cases, if I'm not mistaken. Can that be attributed at all to Halloween now that we're about 2 weeks away?
I think that it can be attributed to Halloween gatherings as well as a relaxation of our safety measures. We found from our contact tracing that the individuals were a little bit less diligent in wearing their mask than they need to. And so we just really want to double down on you need to wear your mask and you need to stop gathering and you need to maintain your distance.
And then, as you were saying, just to clarify, if we continue with the trend of daily cases, we'll be getting a purple mark, you're saying, potentially by next Tuesday if it continues?
Potentially.
Okay.
Potentially.
Thank you.
Thank you, Mr. Devine. Next, we'll answer questions on the phone.
Yes, first up is Fabiola Navarrete with Tu Tiempo Digital.
Hello, good afternoon. Okay, I know you just said that we are gonna try to avoid, the increase of the new cases, but we've heard many rumors or many people who is really concerned about closing up again some businesses. I know you just told us that that's not happening, but if you can please explain this again so people can be like not this worried about this, because they even started to do panic shopping and everybody's calling us and everybody's is getting crazy about all these rumors.
Sure. So right now we are in the red tier. And so businesses can open with modification as per the blueprint guidelines. However, if we do end up in the purple tier next week, we will have 2 weeks to really turn that around. So rather than waiting until we are assigned a purple tier, I really want to encourage everyone, do what you can, not the panic shopping, but really double down again on what we can do, which is stop the gathering, wear your face covering, and maintain your social distance. I think those are really constructive ways to maintain our red tier status.
Okay, thank you very much. And one more question is about the Hispanic people or the Latino people. Are they still being like more infected?
I think that our data shows that disproportionate number of cases are Latinx.
Latinx, okay. And what could it be the problem? Do you have any idea?
Sure. We can say that our Latinx population are also overrepresented in the essential services. So in studies in other geographic areas in other states, essential workers who have to leave their home, who have to travel by public transportation, who also have to work in a employment that brings them with high contact with the public. Those are high risk situations, and also living in high density and may contribute to that as well.
Okay, thank you. That's all. Thank you very much.
Thank you, Ms. Navarrete.
Next up, we're going to Laura Place with Santa Maria Times.
Hi, everyone. My question is also going back to the time of Halloween about 2 weeks ago. And you all had discussed a gathering of high schoolers, like younger people, that took place that resulted in 2 COVID cases. And we've heard that since then, particularly at St. Joseph High School in Orcutt, that cases among their student body have increased greatly. And they've closed their school for 2 weeks, but they are planning to reopen Tuesday. And either Dr. Ansorg or Dr. Dorenoso, I was hoping you could confirm how many cases in that student population have been confirmed.
So I want to approach it from a global perspective. So with regards to Halloween celebrations, on the 30th and 31st, we know that there were 4 parties that involve high school students. And yes, you mentioned that last week we had 2 cases, and this week we have a total of 20 confirmed cases tied to those 4 parties attended by high school students. And I want to say that this is just really a teachable moment, as Supervisor Hart mentioned last week. It's a teachable moment because we went from 2 cases and there were community members that said, what's the big deal? We only have 2 cases. Well, in 1 week span, we went from 2 to 20. And I do believe that this is just the tip of the iceberg, right? So these 20 students came forth because they were symptomatic. And I'm wondering how many more asymptomatic students there are out there that have not seek medical care or testing, and they could be also spreading as well. So these 20 confirmed cases, have exposed their loved ones and their circle of friends to the virus. So it continues the spread. So back to your question about St. Joseph, I can confirm that 11 out of the 20 is from St. Joseph's.
Okay. Thank you. And then a follow-up question to that. I've seen some of the guidelines, shared by specific schools and their reopening plans for their course of action if cases are confirmed on campus after they've opened. And it looks like a lot of them will share with the campus community when 1 or 2 cases are confirmed. But I'm curious if there's like a requirement or at least a very strong obligation for campuses to share with the community if more cases are confirmed, once their schools close. Like with St. Joe's, they're closed now, but they'll reopen on Tuesday. So do they have an obligation to share that exact number of cases with the school community, or does that not apply since they're not technically open right now?
I think that each school has published their own plan for how they are to notify their school community and the community at large. I know that from St. Joseph, when they received notification of their first case, they did publicize the school closure and the return to distance learning immediately. So it really depends on the school and what they have in place.
Okay. Does that, just speaking generally, like with other schools, as more open and some might see cases and decide to temporarily close and then come back, does that concern all of you at all that, parents could be sending their kids back to school once it reopens, but not maybe know the exact number of cases that have come out of an original case during the time when a school is closed?
So when a school has one confirmed case, we are notified, and the schools notify their school community that there is a case. So that notification does happen to the school community, and we've seen examples of that. There have been one positive case here and there with the schools that have been opened, and their school communities have notified, they notified either the class or the community or the school community. But I'm not sure whether they continue to update the community, the school community, as cases increase.
Okay. So it all just depends on the school whether or not they decide to do that?
Yes, we have left it up to the school to notify their school community as to the extent of the cases.
Okay. Well, thank you very much.
Thank you, Ms. Place.
And next up is Tom Bolton with Newshawk.
Good evening. I think my question is for Dr. Del Reynoso. I know you're hoping people will change their behavior, but given the pretty stark rise in cases and given the impending Thanksgiving holiday, I guess I'm wondering what your realistic assessment is, how likely it is that we're going to stay in the red tier and not move up to the purple tier.
I am a person that's hopeful. I think that if you look at the data, we're hemmed in. Kern County also has their first week in the purple, SLO as well as Ventura. So we're surrounded. And I do believe that is why Dr. Ansorg has continue to issue the health officer order for no gathering. I do want to believe that that we can do something about it. It is not futile. We do have that capacity as a community to change the course, and we can demonstrate that.
Yeah, I mean, I appreciate that, but again, I'm just kind of looking for a realistic assessment here of how likely it is that we're not going to go into the purple tier here in the very near future.
I told my staff that I am on pins and needles until I see the state's tier assignment next Tuesday, and that will pave, that will guide our intervention and guide our policies for the days to come.
All right, thank you very much.
Thank you, Mr. Bolton.
And there are no further questions.
Thank you for those questions. On Tuesday at 9 a.m., the Board of Supervisors will hear a presentation from the Public Health Department announcing the county's newest weekly state report card. Our next press conference will be held a week from today on Friday, November 20th at 4:30 p.m. Please continue to practice these 3 simple personal steps every day. It's more important than ever. Number 1, remember to wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands thoroughly and often. Don't touch your face and disinfect surfaces. And number 3, if you feel sick, stay home. Don't go to work and isolate yourself. Call your doctor or clinic and follow their medical advice. Thank you for joining us today. Please be kind, considerate, and patient. We are stronger together, safely apart.